Okay, hello. Thank you for joining us for our discussion today on fertility preservation and really how to optimize outcomes with the egg freezing process. Next slide. Mhm. My name is Dr. Susan Maxwell. I am a physician at Southern California Reproductive Center, and I work predominantly in the Santa Barbara office. And I did my training in obstetrics and gynecology and then reproductive endocrinology and infertility at New York University. I worked in New York for about 5 years before moving to California, where I've been at SCRC for a year and a half. Next slide. Mhm. I'm joined today by Petra Beumer. She is a mindful living expert and the founder of the Mindful Eating Institute in Santa Barbara. She has 2 decades of experience promoting positive lifestyles and is a pioneer in blending Eastern and Western therapeutic approaches in the realm of emotional eating, weight management, and self-care. She received a master's degree in clinical psychology from the University of Hamburg, and she has held influential work-life balance workshops at the California Health and Longevity Institute. She also served as a keynote speaker for the American Heart Association on stress and eating and has presented at Santa Barbara Cottage Hospital. Next slide. Mhm. At Southern California Reproductive Center, we have a proven track record of more than 25 years of experience. We are proud of our 2 state-of-the-art embryology laboratories, one in Beverly Hills and the other in Santa Barbara. We have on-site surgery centers and premier locations in Beverly Hills, Pasadena, and Santa Barbara. Next slide. One of the things that differentiates SCRC is our premier laboratory centers. And we have experienced embryologists, double witnessing verification, and we perform vitrification, which is a flash freezing process on all of our gametes. And we are very experienced with blastocyst biopsy. Our patients opt to do a lot of genetic testing on the embryos through pre-implantation genetic testing for aneuploidy or monogenic disorders. We also utilize the EmbryoScope, which is time-lapse video imaging of our embryo development, which helps us select embryos for transfer. We have certified laboratory directors, and we are CAP accredited. Next slide. Today, we will discuss the importance of mindful eating, and these techniques can help optimize your outcomes when you are undergoing fertility treatments or fertility preservation. We'll discuss age-related decline in fertility, patient evaluation and testing, and then the fertility preservation process. At the end, we'll have a question and answer session, so you can ask all of your questions. Next slide.
I think it's my turn.
Yes, so go ahead, Petra.
Thank you for the introduction,
Mhm.
Dr. Maxwell. I'm happy to be here, and I hope we'll have Q&As at the end. I reached out to SCRC a little while ago because I had found research that your chances of a successful IVF journey is correlated to being at a fairly healthy weight. So you have enhanced success with your procedure, also reduced pregnancy complications, it optimizes hormone balance, and also healthy baby development. And so if anyone listening right now is struggling with weight and has tried dieting before, I have a very different approach, which you will hear about in a moment. And just know that if you want to increase your chances of getting pregnant, reducing your body weight to an optimal level would be beneficial. Next slide. So I'm all about a non-restrictive approach to weight loss. I used to be a weight loss coach for a local clinic here in Santa Barbara. And I realized that over the years, our patients needed much more than just restrictions. And as you can see, a survey asked over 1,000 psychologists which strategies were essential to losing weight and also, more importantly, for keeping it off. And as you can see, the second bullet point, emotional eating, is a pretty meaningful barrier to weight loss. And in my work, I incorporate a lot of cognitive behavioral therapy, mindfulness, and also self-compassion. So it's a very gentle, deep dive into the core reasons, the core issues that make you reach for food when you're not hungry. Next slide. So I mentioned self-compassion. There is a researcher named Dr. Kristen Neff and her team. They have found that the benefits of self-compassion are just so vast, from living a stress-free life, a balanced life, to having more success in weight loss. And even, I would think, on your fertility journey, the kinder you are with yourself, the more relaxed your system is, and it will help you overall. So research indicates that self-compassion can assist somebody in regulating eating and also amplify the effectiveness of mindfulness. So that's a really powerful combination, rather than dieting, obsessing of what's showing on the scale, but bringing in other dimensions such as mindfulness, meditation, and self-compassion. So enhancing mindful and intuitive eating can increase healthy behavior intentions. Next slide. Mindful eating is being present with your food without any distractions. And I believe that mindful eating is just part of a larger umbrella, which I called mindful living, and not rushing through your meal, not doing drive-through, unplugging from electronics, practicing as a family to go dark and turn off your phones, and not watching TV while you eat or during your lunch hour. I encourage people not to be a desk diner. So benefits of practicing mindful eating are obvious. We take our time, we slow down, we chew more, we appreciate our food more, and also change our relationship with food by practicing mindful eating. And here, a tip to incorporate this would be to plan for a mindful meal, either with a friend or as a family, and think, let's really take our time. Let's be present with what we eat, and enjoy ourselves, and maybe focus also on the conversation rather than being distracted and rushing through our meals. So it's nothing complicated. It's basically slowing down, unplugging, and practicing present moment awareness. Next slide. Yes, emotional eating is a key factor for many of my clients. Key factor for yo-yo dieting, struggling with weight, struggling with food. And let's say somebody eats because they're anxious or scared, worried, you name it. How can a diet possibly work if we don't address the core need? And I am a firm believer in rituals, and I believe emotional eating is a ritual for many, many people to get through, to cope. So food has taken on the role of mood regulator. Learning how to self-soothe and self-regulate without food is a longer process. And we know that over time, if we continue with emotional eating, it can have negative effects on physical and mental health. And the good news is you can learn to change your relationship with food. You can learn to fill your inner self-care reservoir as if you were soothing a 7 or 10-year-old little girl who wants to reach for another cookie after having had 3 or 4. And how would you soothe and coach a little one? strategies to identify and manage emotional eating behaviors is one major strategy is to practice a mindful pause. Before you reach for food and you're not physically hungry, if you can just pause for a moment, take a few deep breaths and ask yourself, I had dinner, I even had a little dessert. What am I really in need of? And my little visual, do you need chocolate or a hug? There's a story behind it. One of my clients was struggling with being addicted to sugar. And after working with me for a while, she shared that one night she was pacing through the kitchen looking for sweets. She remembered to pause and ask herself, what am I needing? And she realized, I need connection. I need a hug. I need a cuddle. So she went over to her husband, who was sitting on the couch, and said, can you hold me for a little bit? So I thought it's so sweet. Do you need chocolate or a hug? Sometimes we need both, but oftentimes we may not need the chocolate necessarily. Okay, next. Emotional self-care is not just significant when it comes to weight loss or living a balanced, vital life. I feel emotional self-care on your fertility journey is a key factor. I believe the more relaxed you are, the more you learn how to navigate your emotions well, the more successful your procedure or your process will be. And techniques of practicing this in your daily life are very simple. Again, when let's say you have an emotion like distress or worry, if you can pause, take a few deep breaths and have a 1-minute self-care practice of just pausing, maybe putting your hands over your heart and saying, this is a tough moment. May I be kind to myself? And at the end of my slideshow are links to the research sites that you can tap into. So being self-aware, being self-compassionate, and learning how to self-regulate are so important. And many of us, including myself, weren't given that luxury growing up. We have to learn it maybe later in life, and it's possible. Just imagine how you would soothe and comfort a loved one or a child and give the same love and kindness to yourself. Okay, next slide. So I have two case studies I want to share with you. One was I was working with a night nurse who had weight issues and found me after having tried many, many weight loss programs. And she would come home after a night shift, of course, fatigued, emotionally drained, mentally tired, and then she would eat and gain a lot of weight. And with her, I tried something that worked for her. Now, every client is unique, and the co-creation of new self-soothing rituals is really a lot of joy. It gives me a lot of joy. So in her case, I said, do you like broth or tea? She said, no, I like low sodium broth. Do you have a beautiful bowl? Yes, I do. Do you have a beautiful shawl or a scarf you can put around your shoulders? Said, let's try this. Next time you come home from your night shift, boil some water, get your broth, sit on the sofa, put the shawl around your shoulders and just sip the broth. That did it for her. Now it's a very simple thing to do. And in her case, this is what she needed to give to herself. Now, like I said earlier, everybody's different. The second woman was a highly, highly successful, high-functioning businesswoman here in town. And she couldn't drive by a bakery called Crush Cakes and always get a sweet. And she would say to me, Petra, I need a treat. And she had a sick husband at home, lots of responsibilities at work. And I said, I don't think you need a treat, you need a break. She started practicing setting better boundaries, not answering her husband's calls all the time, and putting her needs first, which is not selfishness. It's really a necessity. And over time, she was able to just drive by the bakery knowing I don't need a sweet. I need a little self-care time, a little me time. Of course, I have many more case studies, but those two always stand out for me. Okay, next, please. So I believe, as a final thought, it's not just about losing weight, it's about creating a lighter existence, both physically and emotionally. One of my favorite self-care quotes is by a young poet named Brianna Weist, and she says, self-care is not just chocolate cake and soft baths. It's creating a life you don't need to regularly escape from. And take this in. Self-care is not selfish, and give yourself the oxygen first. And learning to have a healthy and relaxed relationship with food and your body is 100% possible. I think we have one more slide. So there are some resources, self-compassion, gratefulness, meditation apps that I like, and some recipes that I like to try, Blue Zones and Dr. Hyman. And I also want to mention at this point that Dr. Maxwell and the other physicians and I have thought about me offering a support group for women on their fertility journey. And in addition, I'm also available for one-on-one counseling in a very safe space. And just know that an initial consultation is available at no cost. And I would be honored. And I think that's all I have. Thank you.
Thank you, Petra. These principles are so important for not only patients undergoing a fertility journey, but also those undergoing fertility preservation. And I like how you explain having a lighter existence. And sometimes as you're going through these different treatments, it can feel like you're adding more complexity, more stress to your life. And so creating a lighter existence as you go through these processes does really help you cope, have a better experience, and potentially better outcomes. And we do know that women who maintain a normal healthy BMI between 18 and 25 do have better fertility outcomes. They have better success rates with IVF. We don't know how that correlates to fertility preservation, but as you can imagine, having a healthy weight helps with hormone balance, which may also improve how you respond to stimulation. Okay, next slide. So I wanted to build on what Petra went over today, and first talk about the definition of infertility. So infertility is defined as patients who are less than 35 years old who are trying to conceive for a year, or patients who are over 35 years old who have been trying to conceive for at least 6 months. And the reason the definition of infertility changes is that as women get older, their egg numbers and egg qualities declines, which can make it harder to conceive. So if women are not getting pregnant, who are over the age of 35, it is important that they seek a workup, seek a fertility specialist earlier on. Next slide. And this is just a slide demonstrating the age factor and how the chance of conception each month declines with age. So you can see that the chance of conception is pretty stable between 20 and 25% per month, really up until the age of 30, and then it starts to decline steadily. But we start to see this be more significant after the age of 35. And the reason for this is the potential for an egg, when fertilized, to create a genetically normal embryo goes down as women age. And that's because they're born with all of the eggs they will ever have. Next slide. So this is a graph of how women are born with millions of eggs. And then by the time they go through puberty, they have just over 400,000 remaining in the ovaries. And then each menstrual cycle, they will lose 400 to 500 eggs. So by the time they go through menopause, all of the eggs have been depleted from the ovaries. So there's no way for women to regenerate eggs. And eggs are exposed to all sorts of environmental toxins throughout a woman's lifetime, which may contribute to their declines in egg quality. Next slide. When we are seeing a new patient for an evaluation for either fertility preservation or for infertility, we take a detailed medical history, we do a physical exam, and we do a series of diagnostic tests. Next slide. One particular test that we do is ovarian reserve testing. So we look to see how many eggs are remaining in the ovaries. One test is called an anti-Müllerian hormone, and this is a hormone that is a marker of egg reserve. So the higher the level correlates to having higher numbers of eggs in reserve. Other hormone levels we check is a follicle stimulating hormone. And when this becomes elevated, that is also correlated with declines in egg numbers. And then finally, we do a pelvic ultrasound and we look at the number of antral follicles, which are the little black circles on the ovary. And that also correlates with egg reserve. Next slide. For men who are undergoing fertility testing, it's common to do a semen analysis, and this looks at volume, the concentration or the number of sperm, the movement of the sperm, which is important, and then how they look morphologically. Next slide. There are several benefits to nutrition for fertility. Not only what we discussed with Petra of having a healthy body weight, but eating nutritious whole foods also is helpful for your fertility. We recommend healthy diets such as the Mediterranean diet with plant-based foods, such as whole grains, vegetables, legumes, fruits, nuts, and seeds. Getting adequate protein levels has also been correlated with increased fertility. Folic acid is a supplement, but it's also found in legumes and dark leafy greens, and it is important for reproduction. Vitamin B12 can be found in organ meats and omega-3 fatty acids in fish. Next slide. There are several supplements that we recommend women take who are either trying to conceive or undergoing fertility treatments. One is a prenatal vitamin, and again, this contains folic acid and vitamin B12, which are associated with improved fertility, live birth rates, and lower ovulatory infertility. CoQ10 supplements. CoQ10 is a potent antioxidant, and all antioxidants have been shown to be beneficial for egg quality. And vitamin D levels are associated with higher pregnancy rates and lower miscarriage rates. Next slide. Male supplements that may be helpful for sperm quality are Proxy, which supports male reproductive health, and it includes L-carnitine, acetyl L-carnitine, and folic acid. CoQ10, again, an antioxidant, and vitamin D. Next slide. Avoiding toxins is very important for health of both eggs and sperm. Alcohol, having more than 4 drinks per week during IVF, had a 16% lower live birth rates and 48% higher risk of failed fertilization and lower numbers of eggs retrieved. Cannabis is associated with fewer eggs retrieved and lower fertilization rates. We do see heavy cannabis use affects sperm quality significantly. Tobacco has been associated with reduced anti-Müllerian hormone and egg counts and reduced IVF success rates. And processed foods, so highly processed plant oils can increase inflammation in the body. Next slide. In patients who are undergoing fertility preservation or IVF, this is a 2-week process where women take injections every day for 10 to 12 days. While they are on these injections, we do have them come in every few days for blood work and ultrasounds to see how their ovaries are responding to the treatment. About 2 weeks into the process, the follicles on the ovaries will have grown enough so that we are able to retrieve the eggs. This procedure is done in our surgery center, and patients get anesthesia so they do not feel anything. The procedure itself takes about 15 minutes, and then they go to the recovery room for about an hour. Next slide. The retrieval process involves us doing a vaginal ultrasound, and we have a needle attached, and the needle goes through the vaginal wall into the ovary, and we suction out those eggs that have been retrieved. Next slide. If we are freezing eggs for fertility preservation or egg cryopreservation, those get frozen at the time of the procedure. However, if patients are creating embryos to preserve or are doing IVF, then we fertilize those eggs. And this is a video of an egg undergoing what's called intracytoplasmic sperm injection, where we take one healthy sperm and we inject it into the egg to help assist with fertilization. Next slide. If we're creating embryos, then the fertilized eggs will go into the incubator, and oftentimes we will use an embryoscope, which takes time-lapse images of the embryo as it develops. Next slide. Oh. When the embryos have reached the day 5 or 6 stage, then we're able to do a embryo biopsy, where we take a few cells from the outer part of the embryo, and this biopsy sample is sent to a genetics laboratory where we can do various different genetic tests to look at the health of the embryo. Next slide. So this is a video of an embryo developing over the course of 5 days using our time-lapse imaging. So the embryos go from fertilization to 2 cells, 4 cells, 8 cells, and then they form a morula and then a blastocyst. Next slide. When eggs are frozen or embryos are frozen, they are put through a process called vitrification, which is where the cells are dehydrated. They're placed into cryoprotectants and then plunged into liquid nitrogen. They will remain in liquid nitrogen in tanks that we store on site at our facilities. Our team routinely checks these tanks. We have alarm systems to make sure that the correct temperature is always maintained. Next slide. Sometimes men will want to cryopreserve their sperm for various reasons. And this involves getting a sperm sample, and then it also undergoes the vitrification process and is placed into liquid nitrogen. Next slide. When eggs are thawed in the future for use, about 90% of eggs will survive the thaw process. About 70 to 80% of eggs fertilize normally. And then about 50% of those fertilized eggs make it to the day 5 or 6 stage, where they can be either biopsied and refrozen or transferred to the uterus to achieve pregnancy. Implantation rates from a genetically normal embryo are about 70%, and live birth rates are about 50 to 60%. Next slide. After patients have undergone the retrieval to take the eggs out, we recommend avoiding exercise for about 2 weeks. And this is because the ovaries are still enlarged and need to recover. Light activities such as walking can be continued throughout the process. Egg freezing cycles can be completed in back-to-back months without adverse effects, if that works best for your schedule. Next slide. So we are offering several promotions on our website. You can go to scrcivf.com/promotions to see what the current promotions are in your area. Next slide. And I am proud to work with 3 other wonderful physicians at SCRC, Dr. Mark Surrey, Dr. Hal Danzer, and Dr. Carolyn Alexander. Next slide. If you would like to schedule a consultation to evaluate your fertility, you can call our office, and we will now open it up to questions for myself and Petra in the chat. If you have any questions, feel free to type them in the chat, and then we can address them. So here's a question, how about reciprocal IVF process? So reciprocal IVF is a process where we have a same-sex female couples. One patient may decide to undergo the IVF process and create embryos using donor sperm. And then those embryos can be transferred into the other female partner to carry the pregnancy. What is the typical cost of egg storage? So our current cost for maintaining specimens in storage is $750 annually. Is there a certain time in the cycle egg retrieval happens? Before, after, during your period? So this really depends on the protocol that your physician decides for you to undergo. Oftentimes, we'll either start the stimulation for the IVF cycle either when you get a period on the 2nd or 3rd day, or we use a birth control pill, and you might be on the pill for 10 to 14 days. We then take you off the pill and you would get a bleed and start the cycle. This question says, I've had 6 rounds of IUI, which is intrauterine insemination. I am 43 years old and healthy. Should I move on to IVF? What age do you allow a woman to use her own eggs? So after 6 rounds of IUI, if you are not pregnant, we do recommend moving on to IVF if you are a candidate for that process. Because if you have not conceived after 6 rounds of IUI, that treatment may be ineffective for you. It's not so much about the age to use your own eggs as much as if you are your ovarian reserve and if you have eggs to stimulate for the process. Does PGT or pre-implantation genetic testing detect blood genotype? It does not generally detect blood genotype. If there was an issue where blood genotype needed to be detected, it may be possible to go through what's called PGTM to look for that. But it's not routinely tested. At some point in the future, does using the eggs that we freeze imply that we are not able to conceive naturally, and to use the egg, is IVF required? So this is a good question. When you undergo the egg freezing process and we harvest a cohort of eggs, those eggs are eggs that would have been lost, would have degenerated anyways that month. So we are not decreasing your fertility by taking out those eggs and preserving them. Undergoing the egg freezing process does not mean that you cannot conceive naturally in the future. It just gives you another option for a way to conceive if you are having difficulty. If you are using your frozen eggs, then they do undergo what's called in vitro fertilization. So that's the process where the eggs are thawed and then they are fertilized in the laboratory to create embryos. Question, do you see patients as far away as Sacramento? So we do see patients from a large geographical area, and we perform consultations either in person or we can do initial telehealth consultations. Both myself and Petra can do virtual consultations to patients who live far away. If you do need treatments such as IVF and you do live far away, you may need to make arrangements to stay in the area because you do need to be seen every few days over a 2-week period. So here's a question. Is it okay to try to lose a little bit of weight now before beginning IVF in 2 months? Or is it not advisable to lose weight so close to beginning IVF? What would you say, Petra, to that question?
Well, I would recommend starting sooner than later. Is that correct, Dr. Maxwell?
Yes, and I think you know, I would not be afraid of weight loss before IVF. I think it can only help. And it doesn't have to be extreme weight loss.
Yes.
I think even losing 5 pounds and having a healthier diet and lifestyle has profound effects.
Yeah.
So this question says, I heard there's variation in how aggressively physicians might do stimulation during hormone therapy to harvest eggs. So there are different approaches. Ideally, we try to get women to produce 10 to 20 eggs. Sometimes we can't control that and they produce more. And sometimes because of their ovarian reserve, they produce fewer eggs. But our goal is to have enough eggs produced in one cycle so that we have a good chance of making enough embryos. There are some women who have very low egg counts, and in those cases, they may not need as much medication. So it really depends on the patient in terms of what that treatment approach is. Do conditions like hypothalamic amenorrhea, hypothyroid condition, and other hormone issues affect the amount of eggs and the quality of the eggs that one has. So when a person has hypothalamic amenorrhea, that means that their brain, the hormones secreted from the brain are suppressed, and so they are not stimulating the ovaries in the right way. And hypothalamic amenorrhea is one reason why women don't release an egg regularly. This can affect the number of eggs retrieved in an IVF process. It can also decrease hormone levels such as the AMH. The quality of it doesn't so much affect egg quality, but there are medications that we can use to help overcome hypothalamic amenorrhea. How long do you store eggs for? And if a patient moves out of state, can they come back for in vitro if needed? So you can store eggs indefinitely. We've had patients who have come back 10 years later to use frozen eggs. And if a patient moves out of state, they are able to come back to thaw their eggs. And embryos can also be moved to other locations within the United States. If I had my eggs retrieved and frozen through Kaiser, can I have them transferred to you after? Yes, we can potentially accept frozen eggs or embryos. However, those records must be reviewed by our embryology laboratory and before they approve them being transferred in. And it's really up to the lab director whether or not they will accept gametes from outside of the facility, depending on the documentation and the protocols used. Can intermittent fasting be done during egg retrieval or the IVF process? Is it safe? So intermittent fasting, there are different ways to do it. One way is to simply shorten the amount of hours during the day in which you are eating and having a longer fasting period overnight. Intermittent fasting is generally safe. And if you are doing it routinely, it could be done during the IVF process. However, it is better to lose weight and to optimize things before you undergo IVF. I would not recommend full fasting during the IVF process. If you are born with a fixed number of eggs, how is it that you can grow, multiply more through the process of egg freezing? So we cannot grow or develop more eggs. However, when we give you the injections, the medications, it allows you to ovulate more eggs in 1 month. And those are the eggs that we harvest. So these are eggs that we're potentially going to develop in that month, but we cannot create more eggs in the ovaries. If 15 eggs were retrieved, but only 8 were mature, is this due to an error made by the doctor? No, not necessarily. So all of the eggs grow and mature at a different rate. And not all eggs will ever be mature when you have them retrieved from a process. There's always a range. What about PCOS or polycystic ovarian syndrome? Is there concern for egg quality? So women who have polycystic ovarian syndrome tend to have more eggs in reserve in the ovaries, but this can cause a hormone imbalance, which can make it harder to release an egg each month. sometimes there are concerns about egg quality with PCOS, but women with PCOS, because they have a lot of eggs, tend to do well with fertility treatments such as IVF. What we see with women with PCOS is they, because of these hormone imbalances, they're predisposed to diabetes and weight gain. And it can be very helpful for them to lose weight using some of the techniques that Petra discussed, or techniques like intermittent fasting or having healthy lifestyle. And losing weight in these patients can help balance their hormones and help them to ovulate more regularly. Is an AMH of 0.4 for ovarian reserve enough to do IVF? Yes. Again, there are more, we have to look at the full picture and the case, but AMH alone does not determine whether or not you can do IVF. How many eggs do we hope to retrieve per cycle? Again, we're aiming for 10 to 20 per cycle of egg freezing or IVF. However, it really depends on the individual, how many we're able to obtain. Petra, do you have any last thoughts?
I wish everyone much success on their journey, and I'm here to help, in addition to, of course, the physicians and all the other experts. But if you need more help with the emotional regulation during this journey, I'd be very, very happy to help. And yeah, it's a beautiful thing to strive for, right? To start a family. So I wish you all the very, very best.
Well, thank you so much, Petra, for joining us today. And again, if you are interested in scheduling a consultation, you can reach out to our offices. Thank you.
Thank you.